Made a profit.
Sure.
That's right. Wow.
But somebody didn't die because of it.
It was a tale of two gatherings Wednesday night in Lillington at a healthcare reform town hall held by the State Employees Association of North Carolina and U.S. Representative Bob Etheridge.
Intrusion into your own home, making sure your children are covered.
No, it ain't.
It's in the writing, lady. I've read the bill. Government intervention on child rearing and making sure your children are getting good health care coverage.
Etheridge, a Lillington Democrat, spoke to more than 225 people inside the multi-purpose room at Central Carolina Community College.
And you've heard some of the points already. I won't go all of them. It really means that you're not denied for pre-existing conditions. That doesn't mean anything to a person who's healthy. I would just say to you, if there's anyone in this room who is on Medicare, when you sign up for Medicare at 65, they didn't ask you if you have a pre-existing condition. And they didn't say you got to go to this doctor. You got to go to that doctor. What hospital are you going to go to? You got the card, and currently you go wherever you get to see a doctor. And that's the way it all did.
While outside, groups gathered to make their cases for and against President Obama's proposals for health care reform.
We're on TV, collect the government check. How about that? And we can pay for their house.
That's the most racist thing I've ever heard.
That's not racist. We're sick and tired of calling racist thing in our face.
If this health care is good enough for me, why isn't it good enough for Obama? Tomorrow night at Harlot Central, Congressman Etheridge, who had no town hall scheduled, this kind of came as a last-minute thing, but he's having a fundraiser tomorrow night at Harlot Central. So, based on the way we feel about his vote on the stimulus package, his vote on cap and trade, and his vote on H.R. 3200 in the Ways and Means Committee, we need to show up tomorrow night, and if he won't see us here, maybe he'll talk to us tomorrow night.
Back inside, the crowd was much quieter as Etheridge talked about what Obama's plans will mean to the average citizen.
Doing nothing is not an option. We'll be priced out of the market. $2.4 trillion in 07. That's 79 on average, $7,900. These aren't my numbers. These are PricewaterhouseCoopers numbers, CPA programs. Their total health care spending, as you've heard, was 17%. They're now predicting in the next 10 years, if cost continues to go like they've been, we could be at 1940%. Those are just facts. They aren't my numbers. If that continues, all of us, the people in the middle, because people above 65 are getting Medicare. And if you think Congress isn't going to fund that, you better take another thought. That's going to happen. We're going to find a way to do that. And those in the lower end will get it, but those of us who are working and lose our job, we're calling the squeeze. And that goes everybody. We've got to find a way to
Etheridge also touched on what he called misinformation about the
This
plan.
does not include funding for abortion or the promotion of abortion. Just like if you have current insurance, anyone who has current insurance, whatever your current insurance provides as a basic care, you will still have that. Whatever you got in it, you can have it, but you have to have a basic care. That's not in it.
But not everyone was convinced during the town hall.
End of life, when you're in a crisis mode, you should be with your doctor and your priest and your family. Nobody in government should be involved in that.